The Prime Minister recently announced that nationally we're moving to a new phase of the COVID response. The policy has now shifted to living with COVID. What that means in detail will be, no doubt, uh, clarified as we get more guidance from the centre. However, at this stage, I think it's important for us to reflect on what we do know about COVID in Torbay. It is that the cases have begun to fall, and all of our data are indeed pointing to the fact that this fall is genuine and is reflective of what is going on in the rest of the country. However, despite the fact that the rates are falling, they still remain very high. The latest rates are 580 new cases per 100,000. In the 30 to 39-year-old age group, which is our peak age for infections, that is just under 1,000 new cases per 100,000 population. So with high background rates, the chances that you might come across somebody who is infected, and if you're not careful, can become infected yourself, does remain significant. Now, we've been saying, based on the data that's been emerging both in the UK and internationally, that the Omicron variant does cause a milder disease when compared to the Delta variant of COVID that was prevalent before Christmas last year. But that does not mean that the Omicron variant should not be respected. Indeed, Omicron causes severe illness, particularly in those who are unvaccinated. So we shouldn't trivialize this disease or feel that somehow it has gone away or does not affect people in substantial ways. It is not another cold. And the data does suggest that it does have a greater impact than normal seasonal flu, from what we can gather thus far. The emphasis then is, how do we live safely? And I put the emphasis on the word safely with COVID. And it seems to me that some of the public health measures that we had in place will still be relevant. Hand washing not only helps to reduce the transmission of COVID, but I'm sure has contributed to the decrease in transmission of other infections that are usually common during the winter period. Certainly norovirus, flu, and other respiratory illnesses. I'm sure that good hand hygiene will continue to be relevant as a public health measure. While the background rates are still high, it does make good public health sense and a good sense of courtesy that face coverings are used in enclosed spaces, particularly indoors, particularly where it is crowded. And certainly some shopkeepers and others may continue to ask that clients wear face coverings when they come into those enclosed spaces. That makes good sense while the background rates are still high. As rates come down and hopefully stay down, we may want to reevaluate that, but that seems to make good sense. The reason why restrictions have been eased, and this was definitely part of the reasoning given by the Prime Minister and his medical and scientific advisors, is that we have high levels of immunity in the UK which is due to high coverage of COVID vaccinations, high percentage of people having um, second and booster doses, and also natural infection from those who have been infected or reinfected over the last few months. Vaccination remains one of our key protective measures. There are, however, still a number of people in the Bay who have not had a first or second dose, and still a good proportion who have not had their booster. And we want to encourage people to continue to take up those offers. And we will continue to put on pop-up clinics and walk-in opportunities for people to be able to get their vaccinations and the protection that these offer. And I encourage people to continue to look at the Torbay website for information about how you can access vaccination. Finally, I want to remind us that there are people in our population who are clinically vulnerable, who have conditions that weaken their immune system. And even though they may have been vaccinated, they are not able to mount a full response and therefore are vulnerable should they become infected. These people will need to be more cautious and will indeed be more cautious when they begin to interact with others. It's important, therefore, that we are respectful and that we are mindful that there may be others that we come into contact with who are cautious for good reason, and that we do not do anything that would inadvertently put them at risk for infection. Over the last couple of years, we have all rallied together. We've been very considerate and respectful and responsible in our behavior to ensure that we reduce the risk of infection to ourselves and to others. It's important as we move into this new phase of living safely with COVID that we keep ourselves reminded of those good practices that will continue to protect us and to protect others in the Bay.